I'm Hayley Gilbrook and I'm a professional development sister in critical care. And this is an introduction to respiratory waveforms. Patients are mechanically ventilated for many reasons, and achieving synchrony between the patient and the ventilator can often be quite difficult. However, one way to help understand the interaction between the ventilator and the patient is to observe the breath-by-breath airway pressure, flow and volume waveforms. These waveforms may influence the management of the ventilated patient, providing clues to identifying the various problems associated with mechanical ventilation. But before we look at the waveforms, I'd like to recap on what resistance and compliance is. If we look at resistance, airway resistance, we think of a jack-in-the-box, with the jack trying to open the lid and get out. If we sit on the box, it'll be harder for the jack to push against the lid and get out. This is like an increase in airway resistance. With the increased resistance, it is harder for the air to get into the lungs. If you have increased resistance, you will therefore see increase in peak pressures, and this happens on inspiration. Things that would cause an increase in resistance are things like asthma or sputum. When looking at compliance, we think of a stretched spring. When you let go of that spring, you want it to recoil so that it's ready to be stretched again. This is like a lung. It needs the compliance after inspiration to recoil, ready for the next breath. If you have an increase in compliance, the tighter the spring or lung recoils. This will lead to lower plateau and peak pressures, and this therefore happens on expiration. So if we now look at our waveforms, the first waveform we're going to look at is the pressure waveform. There are three waveforms: volume, flow and pressure. These are all set against time. They should always be viewed together. Again, they are different in volume controlled and pressure controlled ventilation. You have your inspiration, your pause phase, and then your expiration. Now let's look at a pressure waveform on the ventilator. If we look at the top waveform, this is our pressure waveform. It can look very different in pressure control ventilation, which is the one you're seeing now. And if I change the ventilator to a volume control ventilation, you can see how the waveform changes. There is a slower rise in the pressure up to a peak pressure and a slight drop to the plateau pressure before expiration. You don't see that peak pressure in the pressure control ventilation. Looking at the peak pressure and the plateau pressure will show you if there's any changes in the lung compliance. Both of these will rise or fall according to changes in compliance. However, only the peak pressure will change if there's any change in airway resistance. The pressure waveform is also good at indicating when the patient is triggering. If we can mimic this on our waveform, I'll just freeze that screen. You can see a slight deflection before the waveform. That deflection is where the patient is initiating or triggering that breath. The pressure waveform can also help you show if the ventilator is fighting the patient. This can be seen in rabbit ears. If I freeze that waveform, you can see there's lots of rabbit ears. This shows that the ventilator and the patient aren't in synchrony. To rectify this problem, you need to either change your ventilator mode, sedate your patient, or increase their support. We'll now look at the flow waveform. This can be seen at the bottom half of the screen. Again, the waveform is different in pressure control ventilation and volume control ventilation. In pressure control ventilation, which is the waveform we are looking at, there is a decelerating flow. So the flow after the initial flow in during inspiration falls constantly after reaching the preset pressure value. If we change it to volume control ventilation, you can see the waveform changes because this is a constant flow. It flows rapidly in at the beginning of inspiration and then remains for the preset tidal volume before rapidly returning to zero. Flow during expiration depends on the resistances in the lungs and the airway. So therefore, the lines should always appear smooth. And if they're not, there could be some kind of bronchospasm. Flow waveforms are good at indicating insufficient inspiration and expiration times by not returning to zero after initial inspiration or expiration. We can demonstrate this on the ventilator. I have frozen the screen to demonstrate this. At the end of expiration, you can see that the waveform has not had time to return to zero before inspiration has commenced again. The same can happen in inspiration, where this would not return to zero before expiration commenced. To rectify these issues, you need to amend your IE ratios. And finally, we're looking at the volume waveform. This is the waveform at the bottom of your screen. Again, it is different in pressure control ventilation. And if I change it to volume control ventilation, you can see that this waveform is going to show any changes in volume. During inspiration, your volume increases continuously, and then during the pause, it remains constant as no further volume enters the lung, and during expiration, the volume decreases. This waveform is good at indicating if there are any leaks in the circuit, the ET tube, or cuff pressure leaks. We can demonstrate this by creating a leak in our circuit. As this is a volume controlled mode, we can see that the ventilator is having to use higher pressures to deliver the same tidal volume.